Why do I look dead? Like, I swear. Am I Rebecca? Am I a piece of paper? You tell me. I'm way too close to this camera. You're probably here today because you are in a state of cognitive dissonance, struggling to decide whether or not to take ADHD medication, specifically stimulants. Or you have started ADHD medication and are observing some of the positive changes, but also some of the emerging side effects, and are curious if others have experienced anything similar. Or you need medication and you need a diagnosis, but you're procrastinating that diagnosis out of the fear that your physician will turn you away and invalidate your struggles. And if that is you, I'm really sorry, because I know countless that have been there. Persist. In today's video, I'm going to discuss what ADHD symptoms I noticed the most significant improvement in across the domains of inattention, distractability, hyperactivity, and impulsivity, which you would expect considering I'm talking about ADHD. I will discuss the possible side effects and the widely disputed topics, including dependency, addiction, and abuse potential. And I will finish with my position on medication, whether I would recommend it, whether I wouldn't, touching on the debate of therapeutic versus pharmaceutical intervention for ADHD. Spoiler alert, both. Do both. And if you are newly diagnosed with ADHD, you're likely unwrapping all that packages a diagnosis. You're probably feeling a profound sense of relief that you finally know and can account for your lifelong struggles, which can alleviate much self-blame. But at the same time, you may feel demoralised or depressed. And considering you have just been diagnosed with a chronic, incurable condition, feeling sad is natural. Or you may be feeling frustrated and angry, grieving the struggles you've had to endure and the damage ADHD has caused that can't be repaired. But your future does not need to look like your past, and the antidote is getting the help that you deserve now you know what's wrong. You deserve to reap the benefits of the most effective treatment currently available. And if you're here because you have doubts regarding ADHD medication, I guarantee you are not alone in this ubiquitous experience of emotional turmoil. And considering the countless myths that circulate the internet, I'm unsurprised you are unsure or confused. And hopefully my first-hand report on my experience with ADHD stimulants, specifically Elvanse, or Vyvanse if you're... Is Vyvanse the brand name in America? Does it matter? Let's go with it doesn't matter. Hopefully I can enlighten and eliminate some of your concerns. And a quick disclaimer, what I share today is for informational purposes only and should not substitute or replace professional medical advice, diagnosis, or treatment. I feel like it's a given, but always consult your physician or another qualified healthcare professional regarding health and well-being questions. So what ADHD symptoms significantly improved on medication in the dysfunctional domains of inattention, distractability, impulsivity, and hyperactivity? And a quick side note, I take 50 milligrams of Elvanse when I wake up at 5 a.m. and then take a 20 milligram dose early afternoon. So yeah, do what you wish with that. Can't do anything with it. In the domain of inattention and distractibility, I noticed two significant differences, being my overall attention span improved, where I exhibited a more consistent and longer duration of focus during the day. And I noticed a temporary improvement in my working memory. So what do I mean by a more consistent attention profile? Well, instead of exhibiting a pervasive deficit of attention, I seemed to now struggle only with topics of no personal interest or ones I find extremely dull. Actually, that's a lie, because some days I struggled to do the work I actually enjoyed and wanted to do. So scrap that. Irrespective, on these days, completing that work felt like an impossible task, regardless of the consequences of not doing it. You just sit there wanting to bang your head against the wall because
you know you need to do it.
You want to do it, but you just cannot get yourself to do it. I can't even explain the frustration the executive dysfunction causes. And medication giving me this extended period of focus meant I didn't have to rush through all my work before my attention seized, when that same work would take triple the time to complete. It just made daily life tasks at work, at home, just easier, whereas before they felt like a perpetual state of struggle. And my attention profile, next to the improved working memory, made me less prone to distraction throughout the day. Distractions namely being thoughts and social demands. And for anyone who is a little bit unsure of what working memory is, Working memory is a part of our short-term memory, and it essentially allows us to hold a small amount of information in our mind whilst simultaneously executing cognitive tasks. And using your working memory may include things like reading the first paragraph on a page and remembering its content whilst finishing the rest of that page, or asking for someone's email address before you start driving to a destination and having to remember and recall it upon arrival. Someone with a poor working memory, often the case with individuals with ADHD, would have to reread that first paragraph due to forgetting its contents whilst finishing the page, or having to ask for the email address for the second time when arriving in their destination because that individual could not hold all that information in their mind while simultaneously executing the task of driving and processing verbal directions. They are just two examples. However, there is a caveat to this if you are autistic, because although my tendency to be distracted as a symptom of my ADHD was mitigated, being distracted due to sensory sensitivities remained. And you would expect this because the medication doesn't influence that, and my sensory sensitivities were present from childhood and prior to medication. And the symptoms of distractability indicative of ADHD would be things like daydreaming, being distracted by your own thoughts, becoming distracted even when alone with no social demands. And you would expect the right drug to improve this, and it did. But being pulled into a sound that bothered me and perseverating on the noise of my peers typing or the buzzing of the extractor fan in my studio apartment did not dissipate, because the latter was indicative of my sensory sensitivities, which are related to autism. So you still have to adapt your environment to optimize your improved attention profile, which everyone should do regardless if they're autistic or have ADHD. Like, if you want to remain focused, get rid of distractions. People, sound, social media. Throw it in the bin. No, don't throw people in the bin. Don't throw your phone in the bin. Actually, don't do that, but like, do what I said. But irrespective of my autism, the temporary improvement in my working memory when the drug was active meant I could now remember multiple things without losing them to the nearest distraction. And if you were to attend to one of these distractions, I found it far easier to revert my attention back to the previously unfinished, more important task. I remember what I was doing, why I was doing it, and what I was going to do next. And this just made me more productive because I wasted less time trying and failing to draw my attention back to the more important task of focus. And this inadvertently reduced my tendency to overwork. Whereas prior to medication, I felt like I had to squeeze all of the work I had to do into this tiny window of productivity at the start of my days, because that was when my brain was most efficient. And if I did any work outside of this window, it would take quadruple the time it should, or could have, if I did it in that window. It felt like I had this constant cloud of fog in my brain, which just became thicker and heavier as the day went on. And I had to optimize that period at the start of the day where the cloud had less impact. Whereas when I started medication, the strength of the cloud and its impact was less in general. And that period at the start of the day, those few hours after taking your medication, for the first time in my whole life, that cloud disappeared completely. Unfortunately though, my perfectionism and autism, adjacent to the struggles I've mentioned related to ADHD, created a very self-destructive work ethic where I would be so rigid in my need to complete certain tasks by the end of the day, and said to myself I couldn't go out, I couldn't do what I had planned if I didn't get that done. But this did not sync with my inefficient attention profile of ADHD, because it is nearly impossible to be able to get a whole day's work done in 1 or 2 hours in the morning. I don't care what you say, like, it is. And due to the laws of probability, I was always somehow drawn away from my work and disrupted by something, usually people or noises, which meant I had to work far longer hours than I would have if I could have just optimized that tiny little period of focus. And this resulted in me chronically overworking and perpetuated my periods of consistent burnout and poor mental health. So medication for me was good in the sense that it minimised that. Of course, I had to then understand and eradicate the maladaptive sides of perfectionism, but the point is still valid regardless. In the domain of impulsivity, I noticed two major differences, including improved inhibition and a greater proficiency in controlling and managing my emotions. To phrase this more technically, I noticed significant alleviation in regards to my symptoms of emotional dysregulation. And by improved inhibition, I mean my urge to act on impulse was reduced, which translated into both behavioural and emotional responses, which in turn minimised related behaviours such as risk-taking behaviours, verbal heedlessness, interrupting others, and having a greater capacity to emotionally regulate myself affected my interpersonal relationships greatly due to reduced volition and people not feeling like they were walking on eggshells around me, especially my family members, which is just really, really sad. And the how behind the symptom alleviation seemed to be rooted in the medication, providing me with what I would describe as a more significant time gap between thought and action. And by this, I mean prior to medication, I would constantly fluctuate between the extremes of emotion, where my reactions were often disproportionate to the magnitude of the situation. Emotional dysregulation. But I felt the medication created this extended period between the event that triggered my emotion and the subsequent behavioural response, enabling me to become more aware of my urge to react, and it allowed me to alter my behaviour to a more appropriate one, which was unfamiliar to me. Prior to medication, I felt like I had no control over my emotional state or my reactions. This provided time gap, also transferred into my verbal heedlessness, where prior to medication, I would blurt out whatever was on my mind without thinking about whether it was appropriate. Although I never really recognised what was socially appropriate until my friends verbalised it to me. So autism and ADHD intertwined to produce a very unusual presentation, let's just say that. But regardless of autism, this provided time gap allowed me to better process and evaluate my thoughts before I verbalised them. I just felt like I had more control. And you can imagine how my tendency to externalise whatever was on my mind led to some social suicide situations. It wasn't ideal. Saying this, the social difficulties associated with my ADHD symptoms of verbal heedlessness, impaired impulse control were mitigated and alleviated on medication, but social difficulties relating to my autism remained. My difficulty accurately interpreting and recognising social nuances and subtleties within social exchanges remained. I still felt like I lacked this intuitive understanding of the social world, its unwritten rules and the social code, and this in isolation and vicinal to my ADHD led to many social faux pas, but the reasonings for those social difficulties were now not due to my ADHD. By medication alleviating my ADHD symptoms meant I could start to separate and distinguish what social difficulties were due to my autism and what were due to my ADHD, which was profound. Medication was never going to help my autistic social difficulties anyway. The only way I could compensate for those difficulties were through observation, manually learning the social code, and then consciously implementing it. And before I continue to discuss my minimal improvements regarding my internal and external restlessness, it's worth noting that every ADHD individual will exhibit different severities of symptoms associated with their executive dysfunction, because each executive function and its degree of impairment will vary between individuals and will be unique to them. This is why some individuals suffer more with inattentive distractability symptoms of ADHD, whilst others, like myself, suffer more from the impulsive hyperactive symptoms. This is why some individuals have a tendency to dissociate and daydream, whilst others are hyperverbal and excessively talk. They are both manifestations of hyperactivity. Just one is an outward focused behaviour whilst one is inward. The two changes I noticed were regarding my inner restlessness and my physical restlessness and need to constantly keep moving. And I noticed a more significant change in inner restlessness. So prior to medication, I felt this need to constantly move my body, and I had to move my body while simultaneously stimulating my mind. And I would struggle to sit down and maintain a high level of focus for longer than 1 to 2 hours upon waking, when my brain was most efficient. And after medication, I noticed a change, but it was minor. This period extended to 2 to 3 hours. But I have realised that my brain tends to work most efficiently when my body is moving. And over time, I've learned to accept that this need is a non-negotiable requirement demanded by my brain and my body. I have tried to resist it because it is not the typical way of working, but I'm fed up of resisting, so I'm now trying to work with my body and my brain. And side note, through a lot of self-reflection, I think this manifestation of hyperactivity is because of my autistic needs of vestibular stimulation, because bouncing, swinging, walking and running all regulate my body due to the repetitive whole body nature of the movement. And I truly do wonder if this is why I haven't noticed a significant alleviation in my physical hyperactivity. I'm still trying to distinguish what's what. It's an everyday process. Lastly, inner restlessness. I think it's universally known and prevalent across media that if you can find the correct medication, you will notice an alleviation in your symptom of internal restlessness. That feeling of being trapped in the constant chaos that is your mind. Prior to medication, I would wake up flustered over all of the tasks I needed to complete that day and flounder over my struggle to prioritise how, when and which order I would do them in. And even if I did structure and organise my day to a T, I would more often than not panickingly rush through them all in the morning before losing my attention out of fear of being distracted and not finishing them, which was highly inefficient. Whereas on medication, I felt like I could see more clearly. Not so much the things around me, but my thoughts and my ideas. They were clearer, less jumbled and disorganised, and I felt I could hold on to the information in my mind long enough to process and organise it. Whereas before, their presence was fleeting. And if I didn't externalise the information in my mind almost immediately, it would disappear into the void of my mind and never return. I like to use the analogy of a tornado and flying pieces of paper in my mind to allow others to better visualise this improvement, where the paper represents my thoughts and all of the tasks I need to complete, and the tornado's winds represent my ADHD. Before medication, everything I needed to do, the tasks I needed to complete, the thoughts I had to attend to, were all flying around my head, driven by the winds of a tornado. And no matter how hard I tried, I could not reach any of them because of the speeds they were moving and the heights in which they were flying. And if I did happen to grab one that came into reach, I could never hold on to it long enough to read and process it before the winds swept it from between my fingers. I could never catch enough of them to organise and allocate them into the sequence of my day. And as a result, I could never manage all of the information that was entering my brain. I felt like I was trying to find a trend when I could only see one data set or bake a cake with only one ingredient, which is an impossible task. But when I started medication, the speed reduced and the height lowered to a point where I could grab more pieces of paper and hold on to them for longer. This meant I could more effortlessly manage and process the information coming into my head, and in general, my mind felt less chaotic and overwhelmed. Sensory issues aside, because it's a whole nother issue. Therapy, medication, or both. Although medication is beneficial in alleviating most of your ADHD symptoms, and it is the first treatment protocol, it is not the only one available. And because medication doesn't ameliorate all ADHD symptoms, being used in collaboration with therapeutic intervention has proven most beneficial, because the latter is more suitable for identifying and creating coping skills and strategies to manage symptoms uninfluenced by medication. Symptoms such as organisational skills, poor sense of time, forgetfulness, all skills needed as a functioning adult. Honestly, my sense of time is so awful that my friends tell me the wrong time that I need to arrive at an event for because they know regardless I will be late. And they change the times they give me every single time. And somehow I'm still always on time or a little bit late, but it's just funny. Get yourself friends like that. Drug dependency and abuse potential. Yes, impulsivity and poor judgment often come alongside ADHD and can make individuals more prone to drug abuse, paving the path to overindulgence. But when stimulants are used therapeutically and you are not negligent, it's unlikely you'll develop an addiction and abuse them. I think there's a little bit of misunderstanding regarding how one abuses stimulants. Yes, stimulants are frequently abused for those with typical dopamine levels because they do provide a sensation of speediness. But the pleasurable altered state of consciousness is likely only to occur when taken intravenously or snorted into the sinus passages as a powder or a solution. Why? Because it allows the drug to enter and rapidly clear from the brain. This is also the reason why adults with ADHD do not become hooked on stimulants. The drug is taken orally in pill or capsule form and in relatively low doses, which means it enters and leaves the brain slowly. And to bolster my point, stimulants used to treat ADHD bring the dopamine levels up to standard. They do not rapidly raise them well above normal levels. But if you have had a history of addiction or drug abuse, I'd look further into the non-stimulant ADHD medications. Dependency. Becoming dependent on medication seems to be a universal worry, and your concern is valid. Although what I say could be controversial, you do to some extent become dependent, but not necessarily in a negative way or in the way you'd expect. You're dependent in the sense that you now have a clear picture of before and after. You can now clearly compare your life and the struggles you endured when not taking medication. And truthfully, if you don't want this comparison, don't go onto medication. Because I guarantee you, if you find the right drug, you will notice the benefits. And that comparison can then create anxiety around the medication potentially being withdrawn at some point in your life. So what's my position on medication? Considering everything I've said, would I recommend it? I'll put it this way. If you had a child born with a visual impairment and this impairment impacted their day-to-day life, its quality and their ability to function, and you were given the choice to provide this child with a pair of glasses, would you? I guarantee you would, because it's the easiest way to improve the quality of that child's life. Now transfer this concept to ADHD medication. Does an ADHD individual deserve a tougher life than others because they were born with a biological predisposition to ADHD? I can't think of many people who would say yes. That child's difficulty seeing is not their fault. Like an individual with ADHD and their symptoms of executive dysfunction is not their fault. You would be stopping that individual from a life with less struggle to no fault of their own. Opting to not use medication for whatever reason means denying yourself the most effective treatment currently available. And myths abound. Medications don't simply mask the symptoms of ADHD, they correct and compensate the neurological problems underlying the symptoms. Well, at least while the drug is active in the bloodstream and the brain. But regardless, every individual deserves to reap the benefits of a treatment proven to help. Your ADHD struggles are not your fault, and I'm sorry if people have made you think they are. And I acknowledge it is a risk versus reward sort of situation, because you must be willing to endure the potential side effects to reap the benefits of medication. And ideally, when finding a medication, your aim should be to find one that alleviates your worst ADHD symptoms at a dose that provides optimal benefits. But it's also worth remembering that no prescription treatment is etched in stone, and if it proves ineffective or produces intolerable side effects, you can withdraw. And I truly think some people forget that ADHD is a debilitating condition that affects all areas of an individual's life, and that the condition arises from neurological and genetic factors, not a mere personal choice. I swear, if I hear one more person say to an ADHD individual they are lazy and just need to try harder, I will lose. I hope my video neutralised some of your concerns. Maybe it convinced you to try medication or abstain from it completely and tackle your ADHD through purely therapeutic intervention. Either way, you have autonomy over your own choices, which are valid regardless of what I think. Feel free to subscribe if you find value in my content, and I'll see you in the following video.